Here are the top stories for today, April 12, 2021. More doses of hope. Malacanang says over 1.1 million vaccine doses have so far been administered nationwide, with frontliners comprising the majority of vaccine recipients. More time needed. The Metro Manila Development Authority backs LGUs in seeking an extension for the deadline of the distribution of emergency assistance to those affected by the enhanced community quarantine. What's the difference? We tell you what's allowed and what's not as NCR Plus and some parts of the country shift to modified ECQ until the end of the month. And clinical trial for Ivermectin? The Department of Science and Technology says no need, even as it was given a compassionate special permit by the FDA. Good day, I'm William Theo. Welcome to the PNA Newsroom. We begin with the developments of the government's vaccination program. Over 1.1 million vaccine doses have been administered since the country's inoculation drive against COVID-19 kicked off. Citing data as of Sunday, presidential spokesperson Harry Roque said over 1 million got their first dose while over 100,000 got their second dose. Medical frontliners comprise the majority of those already inoculated, over 848,000 of whom already received their first dose, while more than 116,000 got their second dose. The National Capital Region tops the vaccination list with over 280,000 administered jabs, with over 170,000 doses administered in Manila and Quezon City. Roque says the Philippines ranks third in terms of administered vaccines in the ASEAN region.
Ang pinakamarami po ay ang Indonesia with 14,744,000. Susunod po ang Singapore at 1.7. Tapos tayo na po at 1.1 million. Pagkatapos po natin ay Myanmar, Malaysia, Thailand, Cambodia, Vietnam, Laos at Brunei.
The Metro Manila Development Authority supports the move of local government units to seek more time to complete the distribution of emergency cash assistance to those affected by strict quarantine measures. MMDA Chair Benhur Abalos says he understands the challenges faced by LGUs in finding ways to distribute the assistance at the soonest possible time. However, LGUs also have to make sure that the payout of aid will not result in crowding in distribution centers and expose their constituents to COVID-19 infections. Under the guidelines set by the DILG and the DSWD, LGUs only have 15 days to complete the payout of the aid if given in cash upon receipt of the funds for the measure.
Kung bibilisan mo, baka magsiksikan po ang tao eh. No? Talagang andun po yung kinakailangan, ibinabahay-bahay mo yan eh. Pero kung ibabahay-bahay mo naman, hahaba naman ang panahon. No? Kaya yun nga, susulat nga kami sa DILG in the next few days para humingi po ng palugi dingil po rito.
Naiintindihan naman po ng Presidente na mayroong pandemya at kinakailangan ma-avoid natin, maiwasan yung pagtipon-tipon. So wala naman pong magiging problema, pero ang pakiusap pa rin ay sa lalong mabilis sa panahon. Sana po madis.
With the current shift to Modified Enhanced Community Quarantine or MECQ, many are asking what are the businesses allowed and not yet allowed. Presidential spokesperson Harry Roque during his online press briefing said the guidelines and businesses that are allowed on this present status are: under the MECQ, these businesses establishments are allowed to operate at 100% capacity. Public and private hospitals, health emergency and frontline services, manufacturers of medicines, vitamins, medical supplies, devices, and equipment, logistics service providers such as delivery and courier services, essential or priority construction projects, manufacturing related to food and other essential goods, essential retail trade and service establishments such as public markets and grocery stores, food preparations establishments such as kiosks, restaurants, and eateries, but limited to takeout and delivery. Public and private financial service providers, BPOs, public transport, media establishments, medical clinics, veterinary clinics, banks, money transfer services, capital markets, water supply and sanitation services, energy sector, telecommunication companies, airline and aircraft maintenance, funeral and embalming services, security personnel, printing establishments, leasing of real and personal properties, recruitment and placement agencies, teachers, professors and other staff lawyers, and all other establishments necessary for buying and selling of consumer goods online. Meanwhile, religious gatherings are allowed at 10% venue capacity. The local government may increase it to up to 30%. While NCR Plus is currently placed under the less restrictive modified ECQ, strict monitoring on checkpoints are still in place. PNP spokesman Brigadier General Ildebrandi Usana said the PNP has discussed some adjustments for the MECQ implementation in Metro Manila and other nearby provinces starting today until April 30. He says essential travelers will be allowed at 100%, while non-essential travelers may be limited to certain percentages according to the establishments, but not more than 50%. Curfew will remain in place from 8 p.m. to 5 a.m. as agreed upon by the mayors. Compliance with the minimum public health standards will also be enforced, such as wearing a face mask and face shield, social distancing, and frequent hand washing. Usana said checkpoints and boundaries will still remain, but no arrest shall be done. Only warning and fines. Mass gathering is still not allowed. Malls will only be open for essential items. Areas placed under MECQ are the National Capital Region Plus or NCR Plus, as well as Santiago City, Isabela, Quirino Province, and Abra. Areas placed under the General Community Quarantine are Cagayan, Isabela, Nueva Vizcaya, Quezon, Batangas, Tacloban City, Iligan City, Davao City, and Lanao del Sur, while the rest of the Philippines are placed under the least restrictive Modified General Community Quarantine. Local government units in the NCR Plus areas adjust curfew hours as it shifts into the Modified Enhanced Community Quarantine effective today. MMDA Chair Benhur Abalos said Metro Manila mayors have agreed to implement unified curfew hours from 8 p.m. to 5 a.m. starting today until April 30. However, he said local chief executives can still make their adjustments on the recommended time. Meanwhile, in Antipolo, curfew is set at 8 p.m. to 6 a.m. Dr. Junjun Henares, spokesperson of Antipolo City Mayor Andrea Bautista Henares, said that amid the curfew hours, health restrictions in the transportation and other measures will still be strictly implemented. In Taytay, curfew time is also set at 8 p.m. to 6 a.m., excluding essential workers. Police also continues its oplansita or apprehension of curfew violators and non-authorized persons. Meanwhile, curfew in Cavite is set at 10 p.m. to 4:30 a.m. Governor John Vic Remulla in his Facebook page said factories are allowed to operate at 50% capacity, while mall hours will only sell essential goods from 9 a.m. to 6 p.m. The Philippine National Police is going after unregistered sellers of the anti-parasitic drug Ivermectin, which remains a prohibited drug in the country. Ivermectin products are currently registered for veterinary use and are only allowed for the treatment of internal and external parasites, as well as prevention of heartworm disease in animals. Following reports on the presence of Ivermectin in the market and its alleged use to cure COVID-19, the PNP's Criminal Investigation and Detection Group, or CIDG, intensifies its operations to monitor the distribution and use of Ivermectin across the country. The CIDG says it will go after those who will violate Republic Act 9711 or the law on fake, unregistered, and unlicensed drugs. Still to come, digital payout for aid. The DILG says this is a good option. And the province of Negros Occidental wants to return to general community quarantine. We tell you later why. More on this when the PNA Newsroom continues.
Alamin kung paano ang tamang pagsusuot ng surgical mask. Una, hawakan ang mask sa strap at siguruhing natatakpan nito ang inyong bibig at ilong. Tandaan, ang may kulay na bahagi ng mask ang dapat nasa labas. Ito lamang ang tamang paraan ng pagsuot nito. Ihulma ang nose piece o maliit na metallic strip ayon sa hugis ng inyong ilong. Iwasan ang paghawak sa inyong ilong at bibig. Kung marumi na ang mask, hubarin ito gamit ang strap at itapon ito sa isang basurahan. Siguruhin ang maayos na paghuhugas ng kamay gamit ang sabon at tubig. Ang surgical mask ay dapat gamitin ng mga pasyenteng may sakit sa baga o mga taong mayroong ubo, sipon at lagnat, mga nag-aalaga sa mga may sakit, at mga healthcare at frontline workers. Maaari ring magsuot nito kung kayo ay pupunta sa matataong lugar. Basta't sama-sama at laging handa, kaya natin to! Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito.
More local government units are using electronic financial aid distribution systems to deliver the Ayuda payout. They say dispersing the financial aid electronically or through financial institutions prevents crowding in their areas. The Department of the Interior and local government lauded the said move of the LGUs for efficient disbursement of funds. DILG spokesperson Undersecretary Jonathan Malaya, however, advised them to shoulder the service fees charged by digital service providers. He also requires the LGUs to make the list of beneficiaries transparent to the public. Malaya reiterates the need to establish a grievance and appeals committee to address complaints. Chief Presidential Legal Counsel Salvador Panelo dared senators to donate their one-month salaries to supplement the 1,000 peso ayuda or assistance for poor Filipinos. In his online commentary show Counterpoint, Panelo urged them to refrain from trying to bring the government down and instead focus on efforts to provide additional help.
Hindi po ba nagbigay ng, anong tawag dito? Nagbigay ng ayuda, 1,000. 1,000 dahil ng ECQ tayo. 4,000 sa bawat pamilya. 1,000 sa isang mamamayan. Abay, biro nyo, sa halip na matuwa, sa halip na purihin ang pamalaan, pinupulaan pa. Bakit daw 1,000 lang? Yan si Jejomar, Binay, yan si Risa Ontiveros. Itong mga ito, magre-reklamo, kulang yan. Saan ba makakaabot yan? Kayo naman. Magkano ba ang budget dito? 29 billion? Para mabigyan natin ng ayuda yung ilang milyong Pilipino. Kung yung pagpula nyo, dinadagdagan nyo galing sa mga sahod ninyo o sa mga kayamanan ninyo, dagdagan nyo kaya yung 1,000.
The country's national vaccination program gets an added boost after some 500,000 more doses of Sinovac vaccines arrived on Sunday from Beijing. Officials led by National Task Force Against COVID-19 Chief Implementer Carlito Galvez Jr. witnessed the arrival at Ninoy Aquino International Airport Terminal 2. Galvez said the new delivery is part of the 25 million doses of CoronaVac vaccine secured by the government from China's company Sinovac Biotech. The Philippines initially received 1 million doses of the procured supplies on March 29. A total of 1.5 million doses will arrive on April 22nd and 29 and another 2 million in May. Galvez, meanwhile, said the government remains committed to access more shots to hasten immunization. Jabs from Russia's Gamaleya Research Institute and U.S. firm Moderna will arrive later this month, while deals with Pfizer-BioNTech are ongoing. The local governments of Bacolod City and Negros Occidental now require travelers to register in the Safe, Swift, and Smart Passage, or SPass, before entry or exit. More on this and other news from the provinces from Marita Muay.
Travelers to and from Bacolod City and Negros Occidental are now required to register in the Safe, Swift, and Smart Passage, or SPass travel management system. Inbound travelers should secure an electronic or printed copy of the approved travel coordination permit issued by the S-Pass. This, as the Bacolod City Health Office said, they will stop the online issuance of medical certificates for travel after April 15. In Negros Occidental, Governor Eugenio C. Lacson required the mandatory registration of all travelers to the S-Pass since April 9. In Legazpi City, the local interagency task force placed at least 3 establishments here under lockdown after a worker in one of these firms was found positive for COVID-19. Mayor and IATF Chair Noel Rosal said the closure took effect on Saturday, April 10, to give sufficient time for disinfection and contact tracing and testing. The City IATF earlier ordered a temporary lockdown of the PhilHealth office in Barangay Ilawod, Banco de Oro branch in SM City, and the Lucky Fortune Seafood Restaurant also at the SM Mall in Barangay Bitano. The DOH Bicol tracker for April 10 showed the region logged 5,937 cumulative cases with 4,874 recoveries and 239 recorded deaths. Meanwhile, Mayor Leticia Sebastian of Jones Isabela issued an executive order imposing a hard general community quarantine in the municipality until April 30. This as the interior town recorded 134 active COVID-19 cases as of April 10, pushing the number of confirmed cases to 358. Sebastian also ordered the suspension of PhilSys ID Step 2 registration in the town until April 19, while massive contact tracing, swabbing, and disinfection are conducted at the town hall and other buildings. The town's registration center, municipal feeding center, and sports complex have remained under lockdown aside from schools which were ordered temporarily closed by the Department of Education. For the PNA Newsroom, I'm Marita Muaje.
Health measures are in place for the annual observance of the holy month of Ramadan. Claire Gighe gives us an update on how it will be commemorated by the Muslim community.
The Provincial Interagency Task Force, or PIATF, on emerging infectious diseases in Marawi City tapped ulamas or Muslim scholars and imams or religious leaders to help advocate on how to stay safe from COVID-19 during Ramadan.
Matatanda natin na may mga religious aspects sa protocols na kailangan consider. And we need not only the guidance but also the support of the ulama sector in implementing this.
Kali also pointed out that the ulama sector plays a great role in making the Muslim understand the pandemic situation and the importance of observing health protocols in preventing the spread of the virus. Marawi City Ulama Council and Islamic Affairs Chairperson Abdul Karim Siddiq also said they will reach out to the public during Friday sermons, seminars, and prayers in mosques. Meanwhile, PIATF Deputy Chairperson Dr. Alina Derminalang introduced the MECQ campaign to the ulamas, which includes managing fake news, educating the right things to do, conveying the truth to people, cooperating, and assuring and availing of the COVID-19 vaccine. He said attendees of physical gatherings during Ramadan, such as prayers, pilgrimage, and communal meals, should also follow mitigation measures as promoted by the World Health Organization.
Huwag natin kalimutan yung pag-comply sa lahat ng mga medical standards, lalo na pag nasa mga place of worship tayo, sa masjid, at sa mga ibang lugar kung saan yung mayroon tayong mga nagtitipon ng mga tao.
The PIATF of Lanao del Sur continues to strengthen its pandemic response through information dissemination on COVID-19, while Ramadan is set to start tomorrow, April 13. For PNA Newsroom, Claire Gighe of the Philippine Information Agency, Iligan City Information Center.
Negros Occidental officials seek the province's return to general community quarantine from the current MGCQ classification due to a continued rise in COVID-19 cases. Governor Eugenio Jose Lacson sent the request to the Western Visayas Regional Interagency Task Force and the Regional Task Force for COVID-19 on Saturday. The RIAITF and RTF endorsed the resolution on the next day. As of April 10, active cases in Negros Occidental surged to 1,123 from a two-digit level in February. 267 new cases were reported that day, according to the Department of Health. Overall, Western Visayas has 2,939 active cases as of Saturday. Negros Occidental was placed among those under MGCQ until April 30th. Up next, the DOST says there is no need to hold clinical trials for anti-parasitic drug Ivermectin. And Britain bids farewell to Prince Philip in a royal funeral set on April 17. The PNA Newsroom returns after these reminders.
Alamin ang tamang paraan ng pag-ubo upang mapigilan ang paglaganap ng Coronavirus Disease 2019. Ugaliing magdala ng panyo o tissue. Kung uubo o babahing, takpan ang buong ilong at bibig gamit ang panyo o tissue. Kung walang dalang panyo o tissue, maaaring gamitin ang braso na pantakip. Kung nakararamdam na kailangan umubo o bumahing, agad na dumistansya sa mga tao sa paligid. Huwag dumura kung saan-saan, gumamit ng tissue at itapon sa basurahan. Ugaliin ang paghuhugas ng kamay at paggamit ng alcohol o hand sanitizer upang mamatay ang mikrobyo. Basta't sama-sama at laging handa, kaya natin to! Isang paalala mula sa DOH, PCOO, KBP at ng himpilang ito.
You're still watching the PNA Newsroom. The Philippines addressed the ongoing situation in the South China Sea before ASEAN leaders in the virtual ASEAN Senior Officials meeting on April 7. Acting Foreign Affairs Undersecretary for Bilateral Relations Elizabeth Buensuceso underscored the Philippines' commitment in the Code of Conduct in the South China Sea negotiations between ASEAN member states and China. Buensuceso addressed the continued development and lingering presence of China's maritime militia within the Philippines' maritime zones. She emphasized that actions that intimidate, escalate tensions, and undermine mutual trust and confidence violate sovereign rights, especially those that run counter to international law. Meanwhile, Buensuceso called on ASEAN leaders to jointly push for equitable access to vaccines. She stressed that ASEAN should expedite its vaccine procurement so as not to lag behind in efforts to achieve herd immunity and to address reports of global shortage of vaccines. The Mindanao Indigenous Peoples Council of Elders and Leaders expressed its support to the National Intelligence Coordinating Agency for exposing the actions of the CPP, NPA, and DF. MIPCEL said it stands with NICA Director General Alex Monteagudo's efforts to expose the infiltration by communist terrorists of the civil service sector and other branches of the government. It cited the modus operandi of the Communist Party of the Philippines in infiltrating government bureaucracy and sabotaging government programs through legal fronts such as Courage. It also mentioned underground mass organizations such as the Revolucionario Organizadong Lumad in Mindanao and the Cordillera People's Democratic Front in Cordillera, who have victimized IPs. MIPCEL also said child trafficking, child recruitment, and misrepresentation of IPs would not happen if not for communist terrorists working inside government agencies. The Department of Science and Technology, or DOST, does not see a need to do a clinical trial on the use of Ivermectin for COVID-19 in the country. DOST Secretary Fortunato de la Peña last Friday said clinical trials require a minimum of 6 months and could extend to years. De la Peña said there are almost 20 completed and 40 ongoing clinical trials exploring the use of Ivermectin formulations against COVID-19 globally. According to the Food and Drug Administration, or FDA, the registered Ivermectin products in the country for human use are in topical formulations under prescription use only. This is used for the treatment of external parasites such as head lice and skin conditions such as rosacea. The FDA said they need data to determine whether ivermectin is safe and effective in treating or preventing COVID-19 infections. And in our news from overseas, Prince Philip's funeral will take place on Saturday, April 17, and there will be a national minute of silence at 3 p.m. local time. The funeral will take place within Windsor Castle, but there will be no public processions. The royal family has also asked the public to watch the funeral on television rather than turn up to royal residences. The spokesperson for the royal family said it is hoped that the coming days will be seen as an opportunity to celebrate Prince Philip's life, described as remarkable in terms of his vast contribution and lasting legacy. Prince Philip died on Friday, April 9 at the age of 99. The prince planned his funeral, codenamed Operation Fourth Bridge, with the Queen's approval, but last-minute changes were made due to the pandemic. In sports, the Philippines has rescheduled the FIBA Asia Cup qualifiers' third window bubble to mid-June. In a statement on Friday night, FIBA said all the games of the Philippine bubble would happen on June 16 to June 20. The Samahang Basketball ng Pilipinas previously relinquished its hosting rights of the matches of Group A and Group C to Qatar. This as travel restrictions due to the spread of new COVID-19 variants prevented South Korea, which is part of Group A, and Australia, which is part of Group C, from sending their teams abroad. However, the Qatar Basketball Federation begged off from hosting as well due to a COVID-19 surge in Doha, and the SPB got the chance to reclaim the hosting. But in effect, the games had to be postponed. The games will be held in a bubble format due to the pandemic, with the Angeles University Foundation Sports and Cultural Center as the arena and the Quest Hotel in Mabalacat as the official residence. Here's another look at today's biggest stories. More doses of hope. Malacanang says over 1.1 million vaccine doses have so far been administered nationwide, with frontliners comprising the majority of vaccine recipients. More time needed. The Metro Manila Development Authority backs LGUs in seeking an extension for the deadline of the distribution of emergency assistance to those affected by the enhanced community quarantine. What's the difference? We tell you what's allowed and what's not as NCR Plus and some parts of the country shift to modified ECQ until the end of the month. And clinical trial for Ivermectin? The Department of Science and Technology says no need, even as it was given a compassionate special permit by the FDA. Thank you for watching another episode of the PNA Newsroom. To check more news content, visit our webpage or head onto the Philippine News Agency's Facebook and Twitter accounts. For more stories about the government and how it serves Filipinos, look for these hashtags in all of our social media platforms and websites. We are shown on the pages of the PCOO and its attached agencies. Also, watch us on television on PTV4 and IBC 13. And that's your daily dose of the biggest stories that you need to know from the PNA Newsroom. We tell stories that inspire change. I am William Theo. Good day. Stay safe, everyone.